Cervical cancer is a type of cancer that occurs in the cells of the cervix. The cervix is the lower part of the uterus that connects to the vagina. Cervical cancer is a serious health concern, but it is also highly preventable and treatable, especially when detected early. Cervical cancer develops slowly over time. It often begins with precancerous changes in the cells of the cervix called dysplasia. These changes can be detected through regular screening tests, such as the PAP test and HPV testing. Most cases of cervical cancer are caused by the human papillomavirus, or HPV, a common sexually transmitted infection. HPV infection is very common, and most people will clear the infection on their own. However, in some cases, persistent HPV infection can lead to cervical cancer. It's important to understand the risk factors associated with cervical cancer, the methods of diagnosis, and the available management options. Early detection and prompt treatment are crucial for improving outcomes and increasing survival rates. By understanding cervical cancer, we can empower ourselves and others to make informed decisions about our health. Several risk factors can increase a woman's likelihood of developing cervical cancer. Understanding these risk factors can help individuals make informed decisions about their health and screening practices. The most significant risk factor is infection with the human papillomavirus, or HPV. HPV is a common sexually transmitted infection, and there are many different types of HPV. Some types of HPV are considered high risk because they are strongly linked to the development of cervical cancer. Other risk factors include smoking, having a weakened immune system, and having a family history of cervical cancer. Smoking weakens the body's immune system, making it harder to fight off HPV infection. Additionally, women who have a mother or sister who has had cervical cancer may be at increased risk. It's important to discuss your family history with your doctor to determine your individual risk factors and appropriate screening schedule. Early diagnosis of cervical cancer is crucial for successful treatment. Regular screening tests are essential for detecting precancerous changes in the cervix, even before cancer develops. The PAP test, also known as a pap smear, is a screening test that collects cells from the cervix to check for abnormalities. During a pap test, a healthcare provider uses a small brush or spatula to gently scrape cells from the surface of the cervix. These cells are then examined under a microscope to look for any precancerous or cancerous changes. Another screening test is the HPV test, which detects the presence of high-risk HPV types in cervical cells. The HPV test can be done at the same time as a PAP test, or it can be done separately. If abnormalities are detected during a PAP test or HPV test, further diagnostic procedures may be recommended. These may include a colposcopy, which allows the healthcare provider to get a closer look at the cervix, or a biopsy, where a small sample of tissue is removed for examination under a microscope. Section 4. Managing cervical cancer. The management of cervical cancer depends on several factors, including the stage of the cancer, the patient's overall health, and individual preferences. Treatment options may include surgery, radiation therapy, chemotherapy, or a combination of these approaches. Surgery may involve removing the tumor or the entire cervix, depending on the size and location of the cancer. Radiation therapy uses high-energy rays to kill cancer cells and shrink tumors. Chemotherapy uses drugs to kill cancer cells or stop them from dividing. In recent years, targeted therapies have emerged as promising treatment options for cervical cancer. These therapies specifically target cancer cells while sparing healthy cells, potentially reducing side effects. Throughout the treatment process, it's essential for patients to have open communication with their healthcare team and to seek support from loved ones. Support groups and counseling services can provide emotional and practical assistance during this challenging time. Section 5. Early detection saves lives. Cervical cancer is a preventable and treatable disease, especially when detected early. Regular screening tests, such as the PAP test and HPV testing, play a vital role in identifying precancerous changes in the cervix before they progress to cancer. By getting regular screenings, women can significantly reduce their risk of developing cervical cancer. or increase the likelihood of detecting it at an early and more treatable stage. Early detection improves treatment outcomes and increases the chances of survival. It's important to talk to your healthcare provider about your individual risk factors and the appropriate screening schedule for you. By taking charge of our health and getting regular screenings, we can protect ourselves and our loved ones from the threat of cervical cancer.